What will happen in the very early term of this next administration, I believe, and I think within the first 3 months, because the current deadline for SCHIP expires at the end of March, will be a revisiting of an SCHIP reauthorization for an extended period of time. Whether it'll be 10 years, I don't know, but it'll be an extended period of time. And it will be somewhere between the 300 to 400% of the poverty level. That will come in your direction by the beginning of April of this next year. I would suggest to you that is not the direction in which we need to go. Anything that we do that puts more individuals and more kids on insurance that is run ultimately by the state or ultimately by the federal government, I don't believe is the right direction to head because of where those decisions are made. Who's going to be making those decisions? Is it going to be the families and the physicians, or is it going to be the state or the federal government? But it's coming. It's coming. What can we expect out of this new administration in terms of health care? Not a lot of meat on those bones yet. When he ran for president, he had two specific issues that he talked about repeatedly in the area of health care. One is that all kids ought to be covered. And so I think you'll see a mandatory program for kids to be signed up for health insurance. Whether it will be through their employer or whether it will be through the state or some other avenue, nobody knows yet. The problem, as you well know, is when you have a mandate, you got to ask, well, what happens if they don't? Who do you punish? We don't know who gets punished yet. There are three options for who could be punished. First, you could punish the parents. I don't know that that's politically palatable, but one could do that. Two, you could punish the employer, and that's a possibility, given the other parameter that the President-elect has talked about. Three, you could punish the states. So beware. If states aren't signing up enough kids, then states could be punished from the federal government in terms of decreasing resources and other ways to punish states. So beware of what the consequence is of not signing kids up. The second thing that President-elect Obama talked about during his campaign was a pay-or-play system for employers, so that employers would either have to provide health insurance for their employees or pay into a pot of money to provide a resource for those folks who don't have health insurance provided through their employers. That's a challenge as well because it means that the federal government would have to define what health insurance is. And once we as a society allow the federal government to specifically define what health insurance is, then you have all of those battles that you all know so well at the state level for what ought to be included in the benefits package for health insurance. And so that kind of decision-making would come to the federal government in spades. The two individuals that have been identified by the President-elect as kind of his point people, and there are all sorts of other folks involved, but the two that he's mentioned are Senator Baucus and Senator Kennedy, the chair of the Finance Committee and the chair of the Health Committee. Those two folks will be working with others to come up with a plan. I can't tell you where that plan's going to go. At this time in 1992, we were all looking at a remarkably expansive plan. But I will tell you that fundamental reform has to occur because of the money and because of the demographics. What are the alternatives, the positive alternatives that I would suggest to you that are out there? One was mentioned as the Creative Federalism Bill that I co-authored with Tammy Baldwin, who's a wonderful representative from Wisconsin. She and I will tell you, agree about virtually nothing from a policy standpoint. Tammy is as far to the left as you could get. She would accuse me of being as far to the right as one could get. But Tammy and I worked together closely for over a year because we were both frustrated that our respective leaderships were not getting anything done in the area of health care. And we both are concerned about the number of uninsured in this nation. And so we came together with a Creative Federalism Bill that I think would allow for the wonderful laboratory of the states to work, you all to work, to come up with a program that is right for your state to be able to increase the number of insured folks that you have, taking folks off that awful column of the uninsured. It would allow you to get out from under some of the rules and regulations at the federal level, have a streamlined process for getting something approved by a CMS or whatever kind of program you're looking at. It's a bill. H.R. 506 is the bill. I would encourage you to take a peek at it. We will reintroduce it in the next Congress. I think it's a bill that's got great opportunity and great promise. It's something that would allow you all to work your mastery at the state level. Two, we put forward a positive alternative to the SCHIP program. We called our program More Children, More Choices. It's H.R. 2888. And what it did is said that we ought to go to the original premise of SCHIP, which is to cover kids up to 200% of the poverty level. Between 200 and 300% of the poverty level, we ought to provide some type of premium assistance based on income in the family. And then above that portion, to be able to have that creative federalism portion, that the states can have the greater flexibility to provide programs to allow for those kids to be insured in a much more streamlined fashion. Finally, the positive proposal that I've tried to put on the table for fundamental reform of health care, major fundamental reform of health care, is a bill, H.R. 2626. And this is the simple solution to health care. I'm fond of quoting President Eisenhower, who used to say whenever he had a problem that he couldn't solve, he made the problem bigger, made it bigger. And when he got it big enough, then the solution came into focus. I would suggest to you that when you get up at the 30,000-foot level or wherever it takes you to get the problem big enough, for some folks it's 60,000 feet, and you look down, that the problem, the solution rests on two pillars. One is that, in the area of health care, one is that everybody's got to have health insurance. You can't have folks without health insurance in this nation to the tune of 45, 46, 47 million uninsured. You can quibble about those numbers, but at some point during the course of a year, there are about 40-plus million individuals in this nation who are uninsured. So how do you get those folks as a good conservative insured? You do it through the tax code, just like we do everything else. And you start at the top and you provide tax deductions for the provision of health insurance. You move on down, you provide tax credits, then refundable tax credits, then advanceable refundable tax credits. You make it so that the purchase of health insurance by individuals has the same tax preference as employers. You know that. Tax equity for the purchase of insurance. And then you provide pooling mechanisms so that people can pool together in millions to be able to purchase health insurance, private, personal, responsive health insurance in a much more economical fashion than they currently can do so. It's a relatively simple solution. That's the first pillar. Second pillar, that insurance has to be provided on a defined contribution basis, which means that the patient or their family own and control the health insurance policy so that they can do what? Something they haven't been able to do for 30 or 40 years, and that is vote with their feet. Right now, the employer or the human resources officer in an employer's office, by and large, controls what kind of health insurance people have. 60% plus of individuals in this nation get their health insurance through their employer. Make it so that individuals own and control their health insurance policy. That makes it so that the insurance companies have to be responsive to patients in ways that they haven't had to be for 30 or 40 years. That's the way that you move the system in the direction that it ought to move. The system that the direction that this healthcare system ought to move isn't what you think, although I love each and every one of you and you got great ideas. Isn't what we think, what I think. It's what patients think. That's the direction it ought to move. The only way you get it to move in the direction that patients want it to move is to give them the power to be able to define what kind of benefits are in their insurance plan. The only way to allow that is to make it so that they own and control it regardless of who's paying the cost. The bill is H.R. 2626. I urge you to take a peek at it. We are in the education process on that, so if you've got a member of Congress that you think might be interested, let us know. We'd be glad to go visit him or her and talk to them about the simplicity of the solution in the area of health care. Let me close with three specific challenges for you. First challenge is to act boldly. Act boldly. The feds are on their way, and it won't be pretty. Act boldly. Think as expansively as you can at the state level to make the changes that benefit your constituents in the most positive way. Act boldly. Second, this is a tough one. Don't be bought off by federal money. Don't be bought off by federal money. It was always an enticement when I was serving the state senate, and I know it is for each and every one of you. When you're looking for solutions and you see that there's this sometimes easy money out there from the feds, that money always comes with strings. I promise you those strings always form nooses. Don't be bought off with money. And remember, this is an ideal time. This is a wonderful time. It's a time of great opportunity because the challenges are so huge. It's in the tough times that you can make real reform. When everything's easy and we're all on easy street and it's no problem and the money's flowing in, it's tough to make changes then. Now is the time where you can truly make significant reforms, and I would urge you to revisit the first challenge, and that is to think boldly. In short, as Phil said, it's time to get out of the cave. Time to get out of the cave. Let me thank you all so very much for what you do day in and day out. Thank you for the opportunity to join you today. If we can ever be of assistance or service to you, please let us know. God bless you.